I'm Anne Thackeray. I'm a clinician scientist here at the University of Utah, and I started my career really as a physical therapist. And in practice as a physical therapist, realized I wanted to understand better the clinical processes that help people get to their best outcome. And that led me to actually working on a research degree. So I have a PhD from the University of Utah, and now I study clinical processes primarily related to chronic pain. So my research focuses on the implementation of best evidence for chronic pain conditions such as back pain and arthritis. Basically, I look at ways to help clinicians integrate new treatments and evidence for their patients. I focus primarily on a patient-centered approach, which includes studying how we use what's called patient-reported outcomes to understand treatment effectiveness from a patient's perspective rather than just relying on clinical measures. And another key component of my work involves investigating how physical activity interventions can be supported by physical therapists. So by combining these interconnected areas, I'm able to develop comprehensive frameworks that address both kind of the biological reasons for pain conditions, but also the psychosocial aspects of many pain conditions. Well, the relevance of my research really lies in its potential to change how we deliver healthcare for people with chronic conditions by identifying the best research and understanding how we can integrate it into practice. We can improve treatment efficacy while simultaneously reducing our healthcare costs. And our work really addresses a critical gap in healthcare, which is consistency. You can see the same physical therapist across many different clinics and get really kind of a different treatment and potentially a different outcome. And we're trying to get a little more consistent delivery so that people can optimize their outcomes and get back to what matters most to them. So our research really helps the world by developing cost-effective approaches to chronic pain management, which addresses a significant global health and economic burden. By improving the efficacy of treatments or the outcomes that people are getting, we can enhance the quality of life for millions of people suffering from chronic pain. One of the big things that this does is help people more fully participate in work, family, and community activities. In addition, our person-centered approaches encourage sustained engagement in health behaviors, creating lasting lifestyle changes rather than just temporary improvements. This research has far-reaching implications beyond just individual patient care. It really contributes to healthcare system sustainability by reducing unnecessary treatments and hospitalizations while maximizing resources through targeted, effective interventions. The Clinical and Translational Science Institute has been instrumental in advancing my research, both through funding and through invaluable collaborative opportunities. So the CTSI has created platforms for me to connect with researchers across disciplines. This includes basic scientists all the way to implementation experts, and has allowed the fostering of innovative approaches to complex challenges in pain management. Also, through CTSI-sponsored community engagement initiatives, I've been able to incorporate diverse stakeholder perspectives, including patients, clinicians, and administrators, into my research, ensuring that it addresses real-world needs. So this comprehensive understanding of the breadth of problems has really strengthened the relevance and applicability of my work. The CTSI's investment in my research has also accelerated the translation of evidence into practice, helping me and helping others bridge the gap between scientific discovery and meaningful patient impact.